Big news story this week. The Kaiser Family Foundation came out and they said that the average family plan for next year is going to cost $27,000. The year after that is going to cost $30,000. What does that mean? Well, what it means is that now employers are in a tough spot, especially for small companies if they have under 50 employees. They don't have to offer health insurance. They can send you on to the government exchange. However, many of the employers want to offer that, and they want to do that to retain and recruit new employees. But they're stuck now because they can't afford to pay $30,000 per employee. So what are their options? They can put more of the cost on you. Well, pretty soon you can't afford things. And what happens is you don't get a raise now because your raise is that they're covering more of the health insurance. This is a terrible spot that we're in. How did we get here? We got here because of the Affordable Care Act rules. One of the rules of the Affordable Care Act is everybody has to have very comprehensive coverage. One of the other rules is that there's no annual or lifetime limits to coverage. Well, what happens when there's no limits to coverage? What happens is the hospitals can raise their prices. In the old days, when you had an annual and a lifetime limit, the hospitals thought, okay, if we charge over that limit, say it was $1 million, we're not going to get that anyway. But now there's no limit. So no surprise to anybody, they're charging a lot more money. And when you look at what's the cost overrun, why are costs going up so much? Everybody thinks it's the doctors. Well, the doctors are responsible for 8% of all charges, and our fees are actually going down. And then people think, well, the doctors set the prices in the hospital. The doctors set the insurance fees. They set everything. We have absolutely zero control. We don't set anything. When you look at the cost, the number one cost driver is hospital services. They are exploding. And the reason they're exploding is most of the hospitals are nonprofit. They can't show a profit. So what do if they have extra money? They hire more people, they pay them more, and they also build. Every nonprofit hospital right now probably has a new construction project going because that's what they do with their money. They also invest some of that money overseas in investment funds. So that's what they do. So the administrator part of the hospitals has exploded since the Affordable Care Act. So what we need to do is we need to put limits on the coverage, and that will drive the hospital prices down.